It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Hey folks, thanks for joining us. I'm Sam Lesante. A great health show for you today, as usual, from our friends at Lehigh Valley Health Network. I keep telling you folks, the bar keeps getting higher and higher and higher. Today, we're going to talk about, our goal today is to talk about massage therapy, which I love massages, in combination with chiropractic care, which is beneficial to our health. And believe me, I can attest to that. My guest today, no stranger to the Sam Lesante Show. In fact, he wants to take over this show, he told me. Dr. Gavio. Dan, it's always nice to see you. And we have Mary King, who is a licensed massage therapist. And thanks for both of you coming on the show.
Thank you.
I'm excited about the show because I go to both, excuse me, chiropractors and massages. I've been getting massages, I told you prior to the show, a long time. Dan, you're no stranger to the area, okay? No. You've been around here for a while. So tell us just a little bit about yourself and, why you decided to go into chiropractic care and the importance of chiropractic care.
Well, I was born and raised on James Street. I was always interested in anatomy and conservative care. I went to the University of Tampa, got my bachelor's degree in sports medicine, and just decided to go on from there.
Why did you decide to go into, did you want to go into chiropractic medicine when you were in college or
college?
Yeah. What was the distinction between chiropractic versus?
I was interested in conservative care, just treating people conservatively, and like I said, I just moved on from there.
Now, in the study of, because chiropractic medicine has really been evolving over the years, okay? Many years ago, it was like, they didn't look at chiropractors as they look at them today. But, in your training, just so people understand, what about in your training, there's a lot that you learn about the anatomy in the body, right? I mean,
oh yeah, our anatomy is extensive, yeah.
Like versus a medical doctor, I mean, not versus, but you learn as much or in different areas?
Well, I mean, we're obviously taught well on spinal anatomy. My sports medicine background, I have a good base of anatomy with all musculature, the musculoskeletal system.
So, how often do you think someone should see a chiropractor?
I think it's individualized.
Just rule of thumb. I know if you feel good.
I don't think there is a rule of thumb. I don't think there should be a rule.
Let's make one. Okay?
I don't think there should be a rule of thumb. A young kid, a woman who does yoga or a woman or man who does yoga or decompressive stretching, they obviously don't need care as often as a factory worker or a long distance runner. So I don't think there is a rule of thumb. That would take the individualized part out of the care.
The reason I say that is because I know how much chiropractic care helps me out. You're the Lehigh Valley Physician Group, okay, working with them. How does that work for you with the group?
It's amazing for your care. We're in a unit where we're in integrated care, so I work with a physiatrist, I have 2 orthos, our new foot doctor is great, Dr. Portnova, so I could go over cases and we co-treat.
How often do you do that? I mean, basically,
Every day.
Yeah, which is great.
Every day.
Okay.
Yeah, Dr. Abbasi and me are really close. We talk about care and make care plans and treat people together, so.
I'm reading here, okay, which Lisa provides, is always so great, is the fact that, and I have to read it, Hazleton is a multi-specialty medical group practice servicing with close to 50 physicians and advanced practice clinicians representing 15 medical specialties in 21 practices, okay? This is what you have available to you in terms of, if you, and how does that work, for example?
Well, basically, we're all in the same building. Well, not in the same building, but we can refer back and forth. We talk about cases together. It's just better for your care. Like, plus we have MRI right downstairs, X-ray right in our office. Just get a higher quality of care, especially with more than one specialty.
When I said to you, why do most people, well, first of all, most people see a chiropractor if they're, which I think sometimes is always type preventative. If you come, if you have like a yearly visit, or I know you don't like to push visits for just coming in, but I think the spine.
I'm here. I'm here to make you better faster. I'm
Yeah.
here to get you to return to work faster, return to your kids faster, return to your daily life faster, return to exercise faster, not to sell you on maintenance care.
Right. Okay. Now, the spine is extremely important. Okay.
Sure is.
Okay. So therefore, when you go to a chiropractor, okay, you're looking at that spine, and why is it so important that your spine is in proper care?
Well, they're called fixations. Your spine just gets stuck in a motion, basically fixed, and the longer you get fixed in that motion, the faster you degenerate. Your discs don't get enough interstitial fluid, which is nutrition for the disc. Keeping mobile, motion's the best thing for the skeletal system.
Joggers, people who run. Who are pounding on their joints all the time, all right? Does chiropractic care help that at all? Because I know sometimes as they get older,
I treat a wide variety of endurance athletes. Yeah, you're just putting a lot of stress on your joints, a lot of overuse. It's an overuse sport, so yeah.
I mean, I've seen so many people, I think it's good, but sometimes I think after a while, you're pounding on your knees and your hips.
Yeah.
And so can chiropractic care help that a little bit?
Of course, plus I don't treat just the spine. Just had a runner, I treated his Achilles tendon. I treat ankles, knees, hips, frozen shoulders. I treat plantar fasciitis. When your capsule in your shoulder builds up adhesions and you don't get the motion back, I do stretch therapy, active release, that kind of thing.
So if someone wants, like when I go for my yearly exam with Dr. Benio, he'll do heart, he'll do blood work, he'll do PSA and the whole bit. So it's a general thing, and keeping an eye on different things. If someone comes to you, okay, and just says, look, what do you do in general, even though maybe nothing wrong, but do you have like a test that you do, or yeah?
I do an ortho exam, neuro exam.
How's that
I test their motion, and I do motion palpate to make sure all their joints are mobile.
Mm-hmm.
If they're not mobile, I move them. I add motion to them. If I find an adhesion in the muscle, I do some active release or trigger point therapy, fascial therapy.
Sometimes even if you're not having a problem, is there any certain ages that you really should maybe think of getting first of all, do I need a referral to come to see you from a doctor?
No, you don't.
I could just call. The
Yeah,
number there is 501
We're
4LD.
educated to diagnose, so we.
That's the thing. Okay, so maybe is there like a certain age like you should really maybe think of maybe just going to get some like you get a once.
Your body tells you when you need to go.
Yeah.
That's why we have pain.
Yeah, and see the thing is,
So if you're fixed in a motion, they used to call it out. You're out. You're unaligned.
Yeah.
That's not really true. You really just get fixed.
Yeah.
That part of your body just tells your brain, sends these nociceptors, just pain receptors, tells your brain pain, 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 and then you know when to go.
well, Lehigh Valley Hospital, the whole network is focused on major care, but one of the things that they really stress is preventative. Okay, get your test, get things done so nothing develops, which is really bad. And I applaud them for that because they're excellent at that. Mammograms, you name it. Yeah. So with chiropractic care, okay, is it, even though you may not be hurting in some areas, is it best to maybe say, maybe I should go in there and just...
you feel you're tight, you feel, you have lack of motion, yeah. We motion palpate, you make sure your spine is mobile. Do I think there's an age you have to go? No.
Well, what has been your experiences?
I treat a variety of ages, from high school athletes to your age.
My age, I'm 47, right, Lisa? Was 40, 46, 47?
I don't think there's an age. I don't think there's a timeline.
Well, I say that for a reason, because when you hit 50, they say you should go for a colonoscopy or mammograms. There's a rule of thumb, okay? And I understand there's no age involved, especially if you're a sports player and something happens. But
Even
I'm talking...
just someone who works overuse.
Yeah.
Factory works a lot of overuse.
What do you tell your parents while they're under your care? Your patients, I'm sorry. I know what your father will tell you, but I'm saying, what will your patients done?
Well, basically, It's individualized. Everyone's different. I usually give them something to do at home, Mackenzie or Eldoa decompressive stretching or something to strengthen up. I tell them how they're going to feel post-care, and I tell them when they're discharged, and I tell them when, come back when they need it.
Now, we don't have any patients here, okay? I love testimonials because, when you talk to a person, could you give me a case study that someone who came in with a certain thing that was a problem and what you did to relieve them of that? I mean, just without
spinal or outside?
Whatever, say is a person was suffering from this, and then
basically, we'll do an exam, find out what's wrong, and first I'll work the muscle around the joint because it makes it easier to mobilize the joint. Plus, if I mobilize your joint and not work the muscle, by the time you get to your car or do whatever you're doing, your exercise or your work, you're going to get fixed right away. So I take care of the muscle, and then I give them some sort of exercise to keep.
So what should people do in terms of exercising every day? I mean, what should they do to keep their spine straight or keep mobile or whatever?
It depends on the condition.
No condition.
I'm a big fan of Eldoa. It's a decompressive stretching. That'll keep your spine mobile. It'll keep your disc space heightened.
What's it called?
Eldoa.
And how do you do that?
You want me to show you?
Yeah.
I get on the floor.
Oh, you get on the floor.
Well, there's different ones for different parts of the body, but it keeps your joint spaces increased.
How important is walking, for example?
Well, I tell everyone to walk. Even bed rest is the worst. This is a scientific fact. Bed rest is the worst thing on the studies or low back injuries. It would be the worst thing for you. So walking and keeping mobile is better than laying in bed.
She walks a lot, but I mean, she gets yeah, I do 10,000 steps.
Yeah?
Yeah. If she gets me off the couch or whatever. But I'm a true believer. I really feel chiropractic medicine is really, really great. Seriously. I mean, Dan, you're doing a great job up there. I mean, working with, and the fact that you have all these people to work with you.
Integrated medicine is the best for your care.
You've been there for 2 years now, right?
More, yeah, a little more.
Mary, we come back when talking about how does massage therapy work with chiropractic care. And here again, folks, I go for massages a lot. You're going to find out how very healthy they are for you. The number up to get in touch with Dan is 501-4LVH. And as for Dr. Gavio, great guy. And I taught him a lot, folks. Believe me, I taught him a lot. We'll be back after this break. Staying with us, folks. Remember, if you're watching us on Service Electric Cablevision, we're on HD 513 as well as 13. So tune us on if you have a HD set. It's 513. My email, folks, is sam@ssptv.com, and all of our shows, as you know, are on the website ssptv.com. Excuse me. Today, I'm talking to Dr. Daniel Gavio, who is a chiropractor up in the Lehigh Valley Physicians Group, and we also will be talking to Mary King, who is a licensed massage therapist. Now, let me ask you something. Talking about massage therapy, okay, in combination with chiropractic care, when do you refer someone to Mary?
I refer to Mary when I find an adhesion in the muscle or a spasm or a trigger point that I just needs more care that I just can't get rid of with active release or fascial manipulation. So then I refer them over to Mary, and she works on that specific muscle. We talk about the case. Mm-hmm. She knows what muscle to work on. And
so, Mary, coming to you, okay, now you're, thanks for coming on the show.
Thank you.
You're a licensed massage therapist.
Yes.
Right? Okay, now, there are a lot of massage therapists out there. People give massages, okay? What separates you, when you say licensed, what does that mean?
That I am licensed through the state of Pennsylvania, through the Commonwealth of Occupational Health, I believe it is.
So do you have to do various tests before you get that?
Yes, I mean, obviously after my schooling and all the hours and this and that, every 2 years in order to keep our Pennsylvania state license valid, we have to go and take out continuing ed credits. So that's where I'll travel around a bit and take on some new continuing ed credits, which is great because then that way I just keep adding and learning to my practice.
Okay, so the reason if someone's going to go for a massage therapy, okay, it should be a person who is qualified and knows what they're doing.
Oh,
okay?
absolutely.
As I said before at the beginning of the show, I go for massages a lot, okay? And I've learned many, many years ago, since in the 60s, I was getting massages. And we're going to talk about how important they are, but let me talk about you, okay? Tell us a little bit about you.
I'm originally from Long Island, New York. I've been in this area for quite a while, though. Same with Dan, very interested in this kind of medicine and just the great effects of it. And I decided that's what I wanted to do. I put myself in school and worked full-time, went to school full-time, night classes, and got through and did pretty darn well, which I was pretty proud of. And I was very lucky to get a job right out of my internship, which April 4th actually will be my 10-year anniversary of practicing as a licensed massage therapist.
Perfect. Yeah.
And it'll also be exactly 6 months with Lehigh Valley.
So, does someone have to be referred to come to you?
Yes, a doctor has to refer to come see Dr. Gavio. Dr. Gavio will do his assessments, and then he will send them to me.
So you don't do general massages then? When I say just, if like I go for a general massage, a deep tissue massage, and the whole bit.
I do the therapy.
Yeah,
deep
but
tissue.
if someone wants to have a massage, from you, okay?
Yes.
Do they have to go to this guy?
I do the exam.
Yes,
You do
he
the
would
exam.
do the initial exam and send them.
But why would I need the exam if I just want to get a massage?
Because he's a doctor.
Oh, so okay, so that's what I'm trying to differentiate.
It's just to have.
Is it
where-
routine? I mean,
Yeah, it's therapeutic
Okay.
massage, so I do the exam. And,
okay. So what should I expect then? Okay, when I get a massage therapy.
I would, depending on everybody is so different. So depending on your area, depending on, what you're having worked on, I would escort you back to the massage room, and I would figure out exactly, do a little orthopedic assessment after discussing your case with the doctor, and I would then get you situated and comfortable, and we would then work out the spasm, the area, whatever.
Now, do you only concentrate on the area that Dr. Gavio tells you? I mean, if he's saying he has a problem with his back or his whatever, okay, what's the most
Specific-
common thing that you
she's obviously going to do specific treatment on that area, but yeah, she does everything.
Full body, I'm trained in full body,
Okay,
like
so now-
down to plantar fasciitis, like he was saying, feet, arms, legs,
All right, so
carpal tunnel.
if he recommends me to come to you because I'm
Yes.
having a soreness of the back, okay?
Yes.
Now, once you see what the situation is with the back,
Yes.
then you do a full body massage?
Yeah, if you go there, just I'm tight.
Yeah.
She can do a full body massage.
Yes,
Yeah.
if you're
but if
just-
you come to
just-
me for a condition,
I understand.
And I was, I just talked to her. He needs a little work or more work on this
Okay.
area and this.
specific.
So
yeah.
that's how you work together.
Yes.
Okay. So therefore, if because I know if you're a licensed massage therapist, you know what you're doing, and
Yes.
because now, okay, what are the benefits of a full body massage? And first of all, let's explain what a full body massage is.
A full body massages would be literally working from
Your head.
cranial all the way down, working obviously the most important muscles, the tight ones, your trapezius muscles, your neck muscles, doing some stretching, all the arm, biceps, triceps, your normal everyday hands, you have a lot of hard work there, obviously. Legs, hamstrings, everything you could think of, down all the way down to your feet.
So how do you? Okay, so when you're saying deep tissue, okay, and I believe me, I've had
Yes.
I've had many of them. What are the benefits then? You work on sinuses too?
Yes, I do.
Okay. What are the benefits of massage? What does it do for your body?
It, well, first of all, obviously relaxation, circulation, and releases that tension, any tension you have from your everyday stress or from all those tight muscle spasms that are pulling and are causing you your everyday problems like working hard, being on your feet all day, you know, like runners, all those kind of things, releasing all that tension so they can go back to doing what they.
Massage also has a huge benefit on the fascial system.
Yeah.
So fascial system covers and connects everything in your body. Fascial tissue is just layers of dense connective tissue.
Right.
So if I took out everything in your body, you'd have a 3D image of yourself in fascial tissue. Okay, so can you imagine if you have an adhesion or a trigger point in that fascial tissue? It would
So
screw
deep.
so much up because it's all connected. You know what I mean? So if I have an adhesion here, it's going to screw up my elbow or my elbow motion. So massage is going to break that adhesion up.
I'm a firm, strong believer in massages, okay? Particularly because they say, well, should I go gentle? I say, no, you do what you think is best. When you're giving a full body massage, okay, do you know the degree of what you should be, how hard you should be getting into the muscle?
Yes.
Could you? I mean, because sometimes you could feel the muscle if there's
I
knots.
could physically feel them,
because I know
yes.
sometimes you're tense here and they'll work on whatever and so that's what are you doing? Loosening the muscle or?
Yes, you're breaking up. I'm working with the fascia, just breaking up that muscle spasm, and just working that completely out.
So you feel better because
Absolutely.
Yeah.
Because it could cause any tension up in here will cause headaches, migraines, those kind of things. So you release the traps in the neck, you're going to release the headache.
Any dysfunction
Anything.
in the fascial system or the muscle system just fires pain receptors to your brain. So you're always going to feel better if that disruption is taken care of. I mean, it's all neurological.
And we all we coincide, we work hand in hand so well together with.
This hand-in-hand thing I want to revisit because I don't want to be confused. Is massage therapy covered by insurance?
Some.
Okay. Now, here again, I'm watching the show. I see a licensed therapist, okay, who knows what she's doing because you're licensed, which is very important, and you're working at one of the greatest places, all right? And I want to come for a full body massage.
Yes.
When I call and I ask for Mary King, okay, and I say, I saw you on the Sam Lesante show, I'd like to get a full body massage. What do you tell me?
I would have you have your primary care doctor would just send a referral over to our office.
So I have to call Dr. Benio and say, Dr. Benio, I want a full body massage.
Just come see me.
Or you can
come
just
and see Dr.
Yes,
Gavio. Okay.
yes, there would be
So-
two options. You could either have your.
So do you have to see me first before I go to see her?
Just the first visit, and then we figure out a care plan. If Mary says she needs to see it 8 times,
I got
10
you.
times,
Okay.
you only have to see me the first
So it's very,
time.
You just see him the first time,
Okay.
and then send them on.
that's great because
to
it's
me.
it's very thorough then. You know what the
Oh, yes.
Yeah, good.
It's
Folks,
therapeutic massage. Yeah.
talking to Dr. Gavio, interesting, isn't it, folks? I go to chiropractors and I go to therapists. I'm not therapists up here, but I know what you're thinking. But a massage therapist. Yeah, no, yeah.
Relaxation. Full.
You think I need help up here too, right?
Oh no, I'm not saying that.
Dr. Gavio and Mary King and licensed massage therapy. We'll have a lot more with you. Remember the 501-4LVH, folks. We'll be back right after this. Thanks for staying with us, folks. I'm talking to Dr. Dan Gavio and also Mary King. Dan is a chiropractor. Mary King is a licensed massage therapist. And folks, they're located at the Health and Wellness Center at Hazleton. If you just tuned in, you know the show is played many times. I highly recommend you listen to the show. Dr. Gavio, listening to Mary and how you guys work together. Once again, this is like a team approach, right?
Yeah.
So if I'm feeling a little sore, etc., what I should do is call 501-4LVH, ask for Dr. Gavio, say, Doctor, I'm feeling a little sore. I would like to really see Mary King, and then you'd set me up an appointment. And when I come in, you just do what?
An exam and a treatment plan.
Okay, all right. And then you send me to Mary. Okay. Now this Lehigh Valley has a health portal, which I use. Okay. Explain. Oh yes, in fact, I was using it before. I had to send some reports to somebody, and I was using it and printed it out and send it out. I think it's fabulous. Okay, explain what this portal is. Okay.
The portal's a great thing. You got to sign up for it, and you can go on, sign on, and you can look at all your radiology reports, your lab results. You can look at your appointments. Any discharge instructions. You could send a message to me or the office or whatever office you're seeing. It's really convenient, and once you use it, it's great.
I use it because, and sometimes, for example, you said you
I feel everyone should use. I mean, you really should check it out.
So if someone, you know, and of course you would have to, you have to. There's a way to do this.
You sign up. You register.
You sign up. So
I brought you a pamphlet, but I forgot it.
No, it's very. Listen, if I could do it, dummy Sammy on the computer, anyone could do it. It is extremely vital. It's important, and it's very informative because this way you could, you know, look at your results.
Yeah, I mean, if you're interested in your care, it's the thing to have.
Yeah. So you actually, folks, what you do is they'll tell you how to register or sign up for that, and it's a simple thing. Once you log in, then all you have to do is hit log in and results, appointments, you know, health history, you know, the whole, and so what happens is.
You can look at your I know you're pretty forgetful.
Yes.
You can look and see when your appointment is.
Right, Peter? Is your name Peter? Okay. See how he picks on me, Mary? See how he picks on me? Okay. No, I think it's extremely important. So you're located up at the Health and Wellness Center in Hazleton, okay? And once again, a review for chiropractic care and massage therapy, okay? Mary, important that you work together in these different areas?
Very important, very important.
Give me a classic example of, you know, we got a minute left, you know, of a patient who had what, and then what you were able to do to accomplish.
You treat a lot of sports. You talk about some sports patients, yeah.
I would have to say I'm very proud of, we have a triathlete, and he had a lot of, it was the Achilles tendonitis, and which we had at first thought was something else, and that was what doctor had diagnosed him with. And after doctor doing all his myofascial work and stretching and all that, I was able then to work deep tissue, the Achilles tendon, the entire foot, up into the entire calf, and after a few sessions, I actually had that patient come back and tell me that he was able to walk out to his car for the first time without having severe pain in his heel.
Mary also does sports massage, so it helps a lot. You know, you don't have to be a competitor to be an athlete. You can just be a walker or a runner.
Yeah,
right.
Just your everyday, like young high school athlete.
You're playing a softball league or something.
Yeah,
I think it's great. I mean, really, chiropractic care has come so far, and
so
you know, massage. Yes, they have.
Come very far together.
Well, thanks for coming on the show again, Dan. It's always
Thank
nice
you.
to see you, Dan. Dr. Gavio, folks. And Mary King, who is a licensed massage therapy, 501-4LVH. They're located at the Health and Wellness Center in Hazleton. And once again, if you just tuned in, I highly recommend that you watch the Sam Lesante Show and you'll see Gavio, Mary King, and you'll get a lot of information. We'll see you next time.